Last time we met online, we rounded up on the reasons why hospitals can be an enterprise or can be regarded as an enterprise. We discussed on how hospitals work as an enterprise. There are differences between reasons and how hospitals work as an enterprise. Reasons has to do with why. How do they work as an enterprise is different from why hospitals work as an enterprise. Okay, so this afternoon we want to look at how hospitals will be able to perform in a competitive environment. How do self-governing hospitals perform in a competitive environment? Don't forget, we are still under enterprise. So how do hospitals perform in a competitive environment where there is a great or keen competition? How can an hospital perform? Number one, it is often problematic to define and measure either the quantity or the quality of their output. You see, it is difficult to define and measure either the quantity or the quality of their output. That's number one. Number two, it is difficult to regard hospitals as profit maximizing firms. It is difficult to regard hospital as profit maximizing firm. Okay. It is difficult to regard hospital as a profit maximizing firm. So those are the two major reasons why. Let me give you the third one to add to that. Their responses to the economic environment is unpredictable. Their responses to the economic environment is unpredictable. So in a competitive environment, everyone is on their own. So it is for each hospital to now determine what to do when there is a competition. So which means you cannot predict. You cannot predict their responses within the economic environment. You cannot predict, and it is difficult to define and measure their quantity, either the quantity and the quality of their output in such an environment. They cannot easily measure. They cannot easily qualify what comes in or goes out because they want to satisfy their clients. And so it will be difficult to regard hospitals as profit maximizing firms at that moment. So those are the three major points when we are talking about hospitals performing in a competitive environment. I want us to note this term, the term efficiency. efficiency. You may not easily see it from the handout, from the material, but it's right there, hidden within the stuff there. Efficiency relates to how well inputs and outputs are used. Let me take it again. Efficiency relates to how well inputs are used to produce output. Efficiency relates to how well inputs are used to produce output. Just a minute. Okay. Efficiency relates to how well inputs are used to produce output. That is what you put in and what you get. So it depends on what you put in. What you put in depends on what you get. That is efficiency. That is how to measure efficiency. So efficiency relates to how well inputs are used to produce outputs. And we have two types of efficiency. Two types of efficiency. Number one, we have technical efficiency. We have allocative efficiency. Technical efficiency means reaching the objective at the minimum cost. Reaching the objective at the minimum cost. Technical efficiency means reaching the objective at the minimum cost. Second type of efficiency, allocative efficiency. This is all about what to choose as an objective. It has to do with what you are choosing as an objective. That is allocative efficiency. It has to do with what you're about choosing as an objective. Don't forget, I made mention of technical and I made mention of allocative efficiency. Technical efficiency means reaching the objective at the minimum cost. Allocative efficiency is all about what to choose as an objective. Can you see the difference? So efficiency is divided into two types. Right. I will move forward a bit. I want us to go straight to policy and regulations. Policy and regulations. Policy and regulations. Policy and regulations. In fact, I will want us to have three key words here. Policy, regulation, and rules. Policy, regulation, rules. Okay, let me quickly explain the three or define the three so that you must know the difference between the three. Policy is defined as any standard statement or procedure which has to be applied to employees. Any standard statement or procedure which has to be applied to employees and it's adopted by the employer. That is a policy. Like, for example, JPTS has a policy which must be applied to all the lecturers and people working under JPTS. This policy must be adopted by JPTS herself. So it is a standard statement or procedure that must be applied to employees. Now, what is regulation? Regulation is any standard statement, just the same way we start with policy. It's any standard statement or procedure which may include a policy statement which has to be complied with. Right. Which means regulations may even include a policy statement. That means regulation is more powerful than a policy. It is any standard statement or procedure which may include a policy statement which has to be complied with. Right. What is rules? Rules are standard statements also of procedure other than a policy or regulation adopted by an employer to the employee. So which means rules can be a policy and it can be a regulation. But regulation has policy statements included in it. Okay? So those are the differences between the three. All the three has to be complied by the employee, and it is adopted by the employer. Policy is any statement or procedure which has to be complied with by the employees, and it's adopted by the employer. One. Regulation is any standard statement or procedure which may include a policy statement which has to be complied with. Rules, any standard statement or procedure other than a policy or regulation adopted by an employer. Okay. Let me quickly tell us some of the importance of policy and regulations. Importance of policy and regulations. Number one, it sets a general plan of action used to guide desired outcomes. It sets a general plan of action used in guiding desired outcomes. I want to say something clearly. There are some things I'm likely to say right here that you may not easily find in the material. That is the importance of attendance. Like this one I'm talking about, you may not easily get it in your material. Importance of policy and regulations. It sets a general plan of action used to guide desired outcomes. Okay. It helps make decisions. It communicates to employees the desired outcomes of the organization. It sets the foundation for the delivery of safe and cost-effective quality. Cost-effective quality care. Or you say it sets the foundation for providing the best level of care. I repeat, it sets a general plan of action used in guiding desired outcomes. Number two, it helps make decisions. Number three, it communicates to employees the desired outcomes of the organization. Number four, it sets the foundation for the delivery of safe and cost-effective quality care, or sets the foundation for providing the best level of care. Okay? Right. I want us to, I think to some extent, we are done with policy, regulation, and rules. I wouldn't want us to go beyond that level, at least for our level for now. Okay. There is a question, and anyway, take it as a question because I'm giving you the points towards the question. It's the next thing we're going to treat now. Healthcare operations have 5 major distinctive characteristics. Healthcare operations have 5 major distinctive characteristics. Healthcare operations have 5 major distinctive characteristics. This one also is in your book. It's in your book. It's in the material. It may just be hidden while reading it. So that is the reason why you need to listen attentively. Healthcare operations have 5 major distinctive characteristics. What are these 5 major distinctive characteristics? Number 1, patient participation. Patient participation is number 1. Number 2, simultaneous production and consumption. Simultaneous production and consumption. Number 3, perishable capacity. Perishable capacity. Perishable capacity. Number 4, intangible nature of healthcare output. Intangible nature of healthcare output. Number 4, heterogeneity. 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 That is the high levels of judgment called upon and the heterogeneous nature of healthcare. It has to do with the heterogeneous nature of healthcare. That's number 5. So let me explain or say something about the first point, which is patient participation. As the name implies, distinction must be made between inputs and outputs. In healthcare, as in any service industry, to evaluate performance, that is efficiency and effectiveness, a distinction must be made between input and output. So in this case, you need to allow patients to participate. There's no way you can measure effectiveness and efficiency without your patients being part of the roles to be played. Okay? Number 2, which is simultaneous production and consumption. As a service industry, healthcare is produced and consumed simultaneously. It's produced and consumed simultaneously. So this ensures the effectiveness of the service. Number 3, which is perishable capacity. Healthcare organizations they design their own services to serve with certain capacity over a given time. They design their own services to serve with certain capacity over a given time. So if the design capacity is not used during that period, the opportunity to generate revenue from that capacity is lost. Number 4, in healthcare, it is not so obvious what the patient has paid for. So for one thing, since a healing process takes time, the opinions of patients about the service quality of their care are formed over time. So moreover, healthcare is not something that can be tested or handled before deciding on it. You can't say you want to test paracetamol before you buy it. You can't say you want to test the treatment of malaria before you allow yourself to be treated. You can't do that in healthcare. You see, but in a canteen, you can say you want to test their meat. You can say you want to test the rice, whether it is good for consumption. But you can't do that in healthcare. Okay? Right. Let's go further to another topic. We still have enough time. We still have about 17 minutes, so we can still go further. It will even help us if we finish the materials on time, and we can go on revising all that we have done so far. So the next area we're going to right now has to do with strategic negotiation and conflict management. Strategic negotiation and conflict management. Strategic negotiation and conflict management. First of all, we want to look at the word or the term conflict. What do we really mean by conflict? What do we really mean by conflict? In fact, this topic we are treating is in chapter 4 of that material. Chapter 4 of that material. Okay. So, conflict can be defined as a confrontation between individuals and groups. Conflict can be defined as a confrontation between individuals and groups. So if you are asked to define the term conflict, that is where you just stop. But when you are asked to explain conflict, then you go further. So the aim is to win at all costs. The aim of a conflict is to win at all costs. So conflict is inevitable. There's no way you can avoid it. There is no way you can avoid it. There will always be conflicts in any enterprise. Even in JBTS, there will be conflicts, either between the lecturers and the president, or within the staff in the admin and the president, or within the cabals, within the board. Because without conflicts, things cannot go on well. So there is bound to be conflicts. So it is inevitable. It can be managed or resolved. It can be creative or destructive. It can be creative or destructive. Now let us look at what causes conflict. Causes of conflict. Number 1, intolerance. Intolerance, where you cannot tolerate yourself. there will be conflict. Again, we want to talk about lack of basic knowledge. Lack of basic knowledge can bring up a conflict. If what both of you are saying has a deviation in understanding, if I don't have a basic knowledge of what somebody is saying, there will be conflict. There's superiority complex. A situation where I want to prove to be the best. I want to begin to look at the other person as being low to me. Then there will be conflict. A situation where I want to prove myself. I want to value myself more than any other person. Only what I do is the best. Then there will be conflict. A situation where I will always be having the feeling that if I am not there, they cannot do anything good. There will be problem, superiority complex. Inadequate enlightenment. When you are not given a proper enlightenment, there will be conflict. When you are not given a proper enlightenment, there will be conflict. Like, for example, when we're about to start this online thing, myself and Mr. Yomi, for example, we are about to have a conflict. If both of us are unable to manage it, but at the end of the day, both of us agreed. We met at a level. But when we were about to start, it was like a conflict is coming up. Because it got to a stage, I was asking him, how do you want me to link up with this Zoom thing? Okay? How do you want me to link up with this Zoom thing? But at the end of the day, I was able to link up. And Mr. Yomi was happy about it. But if not, if I find it difficult to link up with something, I am likely to be having a conflict with the management, and it will not be Mr. Yomi alone. Okay. So that is inadequate enlightenment. So in the process, I was really enlightened as to how to go about it. So when there is a proper enlightenment, there won't be any conflict. Then poverty. When one is poor, when one is in a state of poverty, there is a problem. I don't know how it is in the book of Quran, but in the Bible, which I know, is that the Bible says poverty destroys. So I don't know how it is written in Quran, but I know in the Bible says poverty destroys, which means if you see yourself as somebody that is in a state of poverty, if you are in a state of poverty, there is problem. There can be conflict. Any little thing that's supposed not to create conflict will come up out of annoyance. If you don't have money, even in our homes, where the father doesn't have money, he will be assuming that the wife understands the situation. So any little thing concerning money, it will flow up. It will flare up. So it's like that. Poverty can bring up a conflict. Then misguided leadership. Misguided leadership. When the leadership in the home is not guided, there can become conflicts. I will round up here because we have just 10 minutes more. So the last point here under the causes of conflict is political interference. Political interference. Like in this country, for example, we have two ruling parties presently, the APC and PDP. There is no way there will be no conflict, especially in the House of Reps. There is no way there will be no conflict in the House of Senate. There is no way there will be no conflict in the presidential, because both of these parties are right there governing us. So there will be rivalries, okay, because of the political interference. Okay, so let me just stop here for today, then we continue next week. Let me stop here today and we continue next week. I want to stop here so that we can start asking questions. Yes, question time. We have 10 minutes more, even 7 minutes more. Question time. Hello? 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 Question. Question. Hello? Hello? Wow. It's time for question. Hello? It is time for question. I'm still waiting. I'm still waiting. Question time.
Mr. Koro, your time is up.
Okay. I think I'm still having 4 minutes.
It's 3 minutes to be precise.
Okay. I'm only waiting if there is any question from the class.
Okay.
Yeah.
Good afternoon, sir.
Good afternoon.
This is Adigiye today from Ikeja Osho, the center, sir.
Okay.
Please, can you refill what you have taught us today from the beginning, sir?
From the beginning, you have to be
No,
precise with your question. Just go straight to a particular question you want to. If really you are part of this lecture, just ask a question concerning the area you are not clear about.
efficiency, sir.
Okay.
The definition of efficiency, I didn't get it very well, sir.
You didn't get it very well.
Yes, sir.
I said efficiency relates to how well inputs are used to produce output. Are you listening?
Yes, sir.
Okay. How well it relates to how well inputs are used to produce outputs.
Yes, sir.
And I made mention of two types of efficiency. Number one is
Yes.
technical.
I
It
got
means
that one.
reaching the objective at the minimum cost.
Yes,
Allocative
sir.
efficiency is all about what to choose as an objective.
Thank you,
Can
sir.
you get the difference?
Yes, sir. Thank you, sir.
Okay. All right.
That's awesome.
Okay.
Thank you.
All right.
Why do you shout like that, Sana? Why do you shout like that? Is your man coming? Why? Because I don't know.